I'm Sheena Larson, and today we're going to be going over some venipuncture. And to help me, I have Dr. Evan Alkema. He volunteered to restrain my animals for me. To start off, I'm going to pretend that I'm going for the canine jugular vein on this stuffy here. And I have everything that I need for blood collection organized here. So I have a 6 ml syringe, a 22 gauge by 1 inch needle, some alcohol, some swabs, and then I have a tiger top tube, which I will use. This is for blood where you need serum. It has the gel down at the bottom and it will separate when spun. And I have the lavender top tube, which has EDTA added to it. And you use that for anything that needs whole blood, so like a CBC. And then I have my Sharpie for labeling the containers, and that would be about it. So we would want to make sure that our patient is as comfortable as possible and that he's being properly restrained. So the jugular vein, we would find it. It's located on the ventral aspect of the neck, just lateral to the trachea. So to start off, I would want to shave the area. So I would shave a small spot just there. I would gently apply alcohol. And then in order to occlude the vein, which is located in the jugular groove, I would kind of rest my thumb in the shoulder and apply pressure. And on a real dog, the vein would pop up. So now that I have the area prepped, I want to just remove the lids off of the vacutainer containers, and I can aseptically grab my syringe and needle, and I can occlude the vein, and at this point it should rise up and I should be able to visualize it. And I can give it another rub with the alcohol to make sure that it's clean. Now that I know where to poke, I can remove the cap from the needle, make sure that the bevel is pointed up, occlude the vein, and then I want to poke and then draw back in one continuous motion. Gently remove the needle. He's going to hold off the vein to prevent a hematoma. And you would remove the needle, and you would gently, to not damage the container, insert the blood into the EDTA tube. You want to go up to the line. You want to use the EDTA tube first because it has the anticoagulant. You would cap that, and then you would gently rotate in order to mix the blood with the anticoagulant. And then you would repeat the process with the tiger top tube. You would go and gently insert the blood into the tube and cap it. And this one here, it doesn't matter if it's clotted because it's going to clot before you spin it and separate the serum. So now when you're labeling, you want to have the animal's name, species, client number, and the date, and my initials. So like here, I have dog Larson, canine, September 30th, 2022, client number 123, and my initials. And I repeat that for the lavender top tube. And Dr. Alkema had held off the vein for 30 to 45 seconds and making sure that the patient is okay and seems comfortable. And this blood should be ready to be sent to the lab. So now I'm going to be demonstrating a blood collection using the lateral saphenous. Dr. Alkema had to leave, so Amy volunteered to take over. So as you can see, we have our dog in lateral recumbency, and I have everything that I need for the blood collection, including clippers. I have a pressure wrap, and we have alcohol and swabs and our vacutainers and another 6 ml syringe and another 22 gauge by 1 inch needle and a Sharpie to label everything. So I would use the same tubes as I did for the jugular blood collection, the Tiger Top with the serum separator gel, and the lavender top with the EDTA anticoagulant. This would be for the chemistry and this would be for the CBC. So to start off, I would want to visualize where the vein is. So I would get Amy to occlude the vein, which is located on the hind limb on the lateral aspect, kind of over the tibia. If you can kind of visualize it, it kind of runs up at an angle. And it can be a very floppy vein, so sometimes you would want to stabilize it with your thumb. So I would start off and I would want to shave a small area and then use a bit of alcohol, being very gentle to not cause irritation. I would want to make sure that I have everything ready. So I would grab my syringe, in my needle, and I would have Amy occlude the vein. And I would want to feel it again, probably stabilize it with my thumb. Wipe again with alcohol. And then I would just slide it in and draw back in one continuous motion. Remove the needle, get Amy to hold off, cap the needle, and apply a pressure wrap. I may have underestimated the size of this guy's leg. There we go. And then that will help to prevent the formation of a hematoma. So then I would remove the needle, grab the EDTA tube because that has the anticoagulant, fill it up to the marker, being very gentle. Don't want to cause any hemolysis. Cap. And then I want to gently rotate the tube to make sure that the anticoagulant is all mixed up with the blood. And then I would repeat that for the tiger top tube. This one, it doesn't matter so much if it clots because it's going to be clotted anyways before it's spun. So I would do that. And now I would make sure to label the vacutainers, so like with the dog's name, species, client number, date, and I would initial. So here they are labeled. And now these samples would be ready to go out to the lab. Now I'm going to be demonstrating a jugular blood collection on a cat. Cole is going to help, and so I have everything set up here. Some more swabs, alcohol, clippers, the vacutainer tubes, Sharpie, and my 6 ml syringe and 22 gauge by 1 inch needle. So on a cat, the jugular is in a very similar position. So it's on the ventral aspect of the neck, just lateral to the trachea. And I have the tiger top tube for the chemistry. It separates the serum, and the lavender top tube with the EDTA anticoagulant for the CBC. So I'm going to start by shaving the area. And then I would want to hold off. That would allow the vein to be visible. And then I would prep with alcohol. And then I would make sure to have my tubes ready. And I would get my syringe. And my needle. So I would prep with alcohol, prepare my syringe, occlude the vein, putting my thumb in the groove in between the shoulder. And then I would want to just gently, they can be quite shallow, and I would just gently draw back, go, ask him to hold off. Remove the needle, fill the lavender top tube first to the level indicated there, being very careful to not cause any hemolysis. I will always want to do the one with the anticoagulant first, and I want to gently rotate it to make sure that the anticoagulant is well mixed. Then I would take the tiger top tube and once again very carefully fill the tube to the level. And this one, it doesn't matter so much if it's clotted because this gel is going to separate the serum. So now, whoop, I label everything with the name, species, client number, date, and I initial the tube. So as you can see, I have them labeled. And now they are ready to be sent off to the lab for analysis. So now we're going to be demonstrating a blood collection on the medial saphenous vein on the cat. So that is done in lateral recumbency. So we want the cat to be comfortable, so we have a non-slip pad here. So to just carefully do that. And the medial saphenous vein runs along the medial aspect of the hind leg, right about here. And I still have the same equipment that I would use. Cats can be a bit wiggly, so as an alternative, I could use a butterfly if I'm anticipating more movement, but I'm not going to for the sake of this demonstration. So I would go and I would shave the area, and then I would have Cole occlude the vein so that I could visualize. And I would have a bit of alcohol and wipe. And then while I get everything ready, he can relax. So I have my Vacutainer containers, so the same ones as before, the Tiger Top tube with the serum separator gel for the running the chemistry, and the lavender top tube with the EDTA anticoagulant, which I would use for the CBC. I also have a pressure wrap to hold off the vein after we have done the blood collection. Oop. So I would prep the tubes. Ideally not drop them. And I would get my syringe. You wouldn't normally use a 6 ml syringe on a cat medial saphenous vein because it has too much suction and it would flatten the vein. But we're going to use one for the sake of this demonstration. And once again, I have my 22 gauge by 1 inch needle. So I would have him occlude the vein by holding off right at the upper portion, or the more proximal portion of the hind leg. I would go with alcohol. I can kind of support the tarsus joint here in order to limit movement on the back leg. And I would make sure that the bevel is pointing up. And then this vein can be quite shallow, so I would want to go in and draw back, remove my needle, get him to hold off, cap the needle, apply my pressure wrap, the cat can relax. I would quickly go to the EDTA tube, and because it has the anticoagulant and we want to make sure that that one is filled first so that the blood doesn't clot, fill up to that line. Gently rotate the tube so that the anticoagulant mixes evenly with the blood. And then I can fill the Tiger Top tube up to the line indicated. Like that, being very careful with the blood so as to not cause any hemolysis. And then I can label the tubes with the cat's name, species, date, client number, and then I would initial it. So there, I've labeled each tube. And they are ready to go off to the lab.